Hi, welcome everyone to our Basics of Chronic Kidney Disease with Cecilia Health. I'm Emily. I'm one of the dietitians and health coaches here with Cecilia Health. Here, before we get started today, you will see at the bottom of the webinar there is a phone number 1-800-263-6317. If you're having any difficulties, please go ahead and give that phone number a call. And just to let you know, this is meant to be an interactive program today. Our speaker, Katie, will be giving a short presentation, but at any time throughout the presentation, you are able to type in any questions that you have underneath the questions tab here on the right of your screen. And as a disclaimer, as always, the Cecilia Health registered dietitian will provide strategies to help you manage your CKD. Now, we know that the information you may hear might motivate you to make some lifestyle changes, but please do talk to your doctor before making any changes. And this online Q&A session is intended to give general advice. This information is not a substitute for any personal medical advice and involves the professional opinion of the Cecilia Health registered dietitian. So today our presenter, like I said, is Katie Gray. She is a registered dietitian, nutritionist, and currently working in our chronic kidney disease program at Cecilia Health. She has 7 years of experience working with patients to prevent and manage chronic diseases like diabetes, high blood pressure, kidney disease, and obesity through nutrition and lifestyle changes. She loves helping people feel their best and understand how food can help their bodies. In her free time, Katie enjoys being outdoors, hiking, and exploring with her husband, toddler daughter, and their big dog, Louie. So thank you all again for joining us today. And Katie, I'll hand it on over. Thank you.
All right, thanks so much, Emily. Hi, everyone. As Emily said, my name is Katie, and I'll be happy to be leading you through this webinar today on the basics of chronic kidney disease. And going forward, I'll be saying CKD just to shorten that up a little bit. And so our agenda for today's presentation, we're going to start out by understanding what our kidneys do and how they work. Going through what chronic kidney disease actually is, the risk factors, symptoms, and complications, talking about how we kind of stage and progress through the different stages of chronic kidney disease and how our doctor might diagnose that. And lastly, management of CKD. So talking about medications, some reliable resources to check out, and what we can do to help keep our kidneys as healthy as possible for as long as possible. So first off, understanding our kidneys a little bit. So if you take both your hands and make a fist, that's about the size of your two kidneys. And most people have two kidneys. Sometimes some people are just born with one, and that's okay too. And they are located just on either side of the spine in your lower back below your rib cage. And the kidneys work to filter our blood. They remove waste products and excess fluid that enter our bloodstream. They also make some vitamins that help control growth in our body throughout our life stages. They're actually involved in the production of red blood cells, and they also release hormones that help regulate our blood pressure. And we'll talk about more about blood pressure and our kidney health in a bit. So what is chronic kidney disease? So CKD involves a gradual loss of kidney function. Sometimes people might have more an acute kidney injury or acute kidney disease, which means their kidneys usually kind of bounce back to normal. But chronic kidney disease, we start seeing a loss in function over time. And more than 37 million adults in the US may have CKD, and most are undiagnosed. And so if you do ever have any questions about that, definitely ask your doctor. And when chronic kidney disease progresses, or we call it advanced CKD, it can really cause dangerous levels of waste products and fluid to build up in your blood. And we definitely want to try and avoid that as much as possible by monitoring and managing our disease. And as I mentioned, it's called chronic because the damage to your kidney disease happens slowly over time. And CKD can also be related to other health problems, which we'll go through next. So just a nice little picture here to kind of show how our kidneys actually filter our blood. So blood enters the kidneys through an artery coming from our heart. So all day, every day, that new blood is going through our kidneys, and it's cleaned by millions of these tiny little filters in our kidneys called nephrons. And so they work to filter out that excess fluid, extra electrolytes, or waste products that build up in our blood just over the course of a normal day. And the waste products that the kidneys filter out enters our bladder and is stored as urine. And then, in a little bit of time, we'll use the restroom and excrete those waste products through our urine. And that blood that went through our kidneys, that newly filtered blood, returns through to our system through our veins and is transported through the rest of the body. And so that process is going on all day, every day. So there are some risk factors that are good to be aware of for CKD. Most notably, diabetes and high blood pressure are the number 2 causes of CKD. So if you know that you have prediabetes, diabetes, or elevated blood pressure or hypertension, it's really important to manage those conditions to help prevent CKD or help slow the progression of CKD. Some other risk factors include heart disease or stroke, living with obesity. If you have a family history of CKD, that can put you at risk as well. If you are a smoker, that can put you at risk of CKD. And then just age. As we age, our kidneys have been working hard our whole life. So sometimes when we're over the age of 60, we have a greater risk of developing CKD. Some other factors, race. So if you're a Black, Native American, or Asian American, that can increase your risk of CKD. Um, Family history, already mentioned. If you were born with abnormal kidney structure, that maybe affects its function, that could put you at risk for CKD as well. And then there are some medications that if you've been using them for a long time or more than prescribed over time, that can lead to CKD. So what happens when you have CKD? What are some of the complications of having this disease? So one of the big ones is fluid retention. So that leads to some swelling, a lot of times in your arms, legs, feet, ankles. So if you ever do notice anything like that, like sudden swelling, that would be something to mention to your doctor. Um, Fluid retention can also, cause high blood pressure, or, in worst case scenario, fluid buildup in your lungs, which is also called pulmonary edema. A sudden rise in potassium levels can also happen especially with more advanced levels of CKD. And so potassium helps control how our muscles contract in our body. And our heart is a muscle. So therefore it can be serious if our potassium levels are going too high in our blood. That can affect how our heart is beating. Um, some patients with CKD end up with anemia, can also lead to heart disease, weak bones, or increased risk of bone fractures, and then also decreased sex drive, erectile dysfunction, or even reduced fertility. Some damage to your central nervous system could result, decreased immune response, making us, more susceptible to those germs that are being passed around. Some more serious complications, swelling of that lining around the heart called pericarditis. If you are in the stage of life, if you're pregnant or hoping to get pregnant, that could cause some complications there. And lastly, especially if CKD is not well managed, it's irreversible damage to your kidneys that can lead to kind of the later stage where you might need dialysis or a kidney transplant for survival. And so the good thing is, if when you have been diagnosed with CKD, there are a lot of things that we can do to prevent further decline, slow down that decline, or to really just help manage some of these conditions we've mentioned already, that can affect our kidney health. And so here are some of the symptoms of CKD. I won't go through all of them today, but when you take a look, a lot of these symptoms are pretty general. And so the biggest thing is if you ever noticed a new symptom that is worsening, has been going on for a long time, definitely mention it to your doctor, and they can kind of help look at your kidneys, see how they're doing, and if it's not from CKD, kind of figure out where it's coming from. But these would be some of the symptoms to look out for, to let your doctor know about. And so understanding the different stages of CKD can be really helpful. And so here you'll see a nice little chart kind of depicting stage 1 through stage 5 of chronic kidney disease. And this helps doctors kind of categorize, how well your kidneys are working, how much function they have lost so far, and what measures we might need to take to help, keep them functioning as well as possible. So with stage 1 and stage 2, you'll notice this kind of second row right here, there's something called your eGFR, and this stands for glomerular filtration rate, and that just tells the doctor how well your kidneys are functioning or filtering out your blood, and this is just done by blood work. So they use this to categorize these different stages. Um, so you'll see stage 1, 90 or greater, and stage 2 between 60 and 89. And so a lot of times if you look at your lab work, sometimes it will just say eGFR greater than 60. And so while that means you still might technically have a diagnosis of CKD, you're in the very early stages and still have, good kidney function to go on. So that's good. In stages 1 and 2 especially, but even into stages 3, 3A, 3B, sometimes people don't have any symptoms. So that's why, when we go back to one of those first slides, when many people are undiagnosed, it's because a lot of times, they're feeling okay and they don't know that, their kidneys have lost some of their function. But through regular blood work with your doctor and visiting your primary care physician, they can do that regular blood work every year that keeps an eye on some of these kidney values. You'll see stage 3A and stage 3B here, where your kidney has lost, mild to moderate amount of its function, and then progressing to stage 4 and stage 5, with stage 5 entering into that period where you might need to talk to your doctor about dialysis or a kidney transplant. And so your doctor will diagnose chronic kidney disease with a few different lab values. So we already mentioned that GFR blood test, so measuring how well your kidneys are filtering out your blood. And that is the main test for doctors to go off of. And next, they will also look at, they can use urine tests too as well. So we know the kidneys filter out those waste products that, enter into our urine. But sometimes if our kidneys aren't working as well, this protein called albumin can leak into our urine. So our kidney wants to keep the albumin and protein in our blood. So if we see that in our urine, that can be an indication of chronic kidney disease. Another result that doctors might look at is something called your albumin to creatinine ratio. So we just talked about albumin being that main protein in your blood that we want to stay in our blood for our bodies to use. And then creatinine is actually a waste product in our blood that we want to get out of our blood. So our kidneys will filter creatinine out of our blood into our urine. And so they can look at a ratio of that urine protein to the urine creatinine. And so, like I said before, higher amounts of albumin just can be a sign that your kidneys aren't working quite as well. If your doctor wants to take a closer look, they may suggest some imaging. So they can do an ultrasound to look at your kidney structure and size to make sure those are all sound. And in more serious situations, they might want to do a biopsy. So that means going in and removing a sample of kidney tissue, which is then just tested by a lab to see, what exactly is causing your kidney issues. There is some other blood work that your doctor can look at. That can tell you your balance of electrolytes and other factors in your blood that could indicate how your kidneys are working. And so they'll always be happy to talk through those with you. And if you've received a diagnosis of CKD, I know it can be really scary, but there are a lot of things that we can do to help manage our condition. And you'll see here controlling blood pressure and controlling blood sugar. Those are the top two things that you can do, since those are, hypertension and diabetes are the number two causes of chronic kidney disease. So keeping our blood pressure ideally, around that 120/80 mark, or whatever goal that your doctor sets for you. And then controlling your blood sugar. And so that can be done through diet and through exercise too. So trying to stay away from a lot of those products with added sugar, whether that's, drinks or food. And that can really help out your kidneys. Because if our blood sugar is running too high for too long, that actually damages all those little nephrons, those filtering bodies in our kidneys. And then the kidneys can't filter quite as well. And it's important to monitor your kidneys with your healthcare team. So whether that's your primary care physician or if they've referred you to a nephrologist or a kidney doctor, they'll let you know how often they want your blood work to be done and how often to have a visit with them. Medication adherence, or taking medications as prescribed, is another important part of managing your kidney disease. So especially if you're on medications for blood pressure or blood sugar, important to take those every day or as prescribed. And working with a dietitian or your dietitian health coach right now on this program to help come up with certain dietary changes that can help you out, and planning meals and snacks around your specific needs that can help keep your kidneys healthy. Exercise is an excellent way to, one, control blood pressure, two, control blood sugar. It can help you keep a healthy weight as well. And all of these things can help keep your kidneys healthy. Getting enough sleep and getting quality sleep is also very important. That's our body's time to rest and recover. So that's always something that you can bring up on your health coaching calls as well. If you notice you're just not getting good sleep, your coach can help work with you on that. If you're a smoker, quitting smoking can do wonders for your kidneys, for your heart, for your overall health. So your coach can always help point you in the right direction of the resources, that are going to be best for you to help you quit. And lastly, finding healthy ways to cope with stress, depression, whatever going on in your life at that time, because that can impact our blood pressure, how we're eating, how we're exercising, which can all impact our kidney health. And so UCare has great mental health resources as well. So if you ever need some more information about that, please don't hesitate to ask your health coach. And I mentioned medications before, so there aren't any specific medications to treat CKD. It's about the medications to help manage the health problems that are related to your CKD. So if that's diabetes, you might be on an oral medication, something like metformin, or you may be on insulin to help control your blood sugars. Blood pressure medications, they're different classes. That just means they work to lower our blood pressure in different ways. So that may include ACE inhibitors, ARBs, or angiotensin receptor blockers, something called beta blockers, and then also a diuretic. Heart disease can also be managed through medications as well. So once again, diuretics helping control that fluid in your body, helping prevent that fluid retention or swelling. Once again, those ACE inhibitors and beta blockers. And lastly, potassium binder. So that's another possible medication depending on your particular situation. Other medications could be related to high cholesterol or high triglycerides. So that's typically in the form of a statin. And as I mentioned before, sometimes people with CKD can develop anemia because our kidneys are actually responsible for producing those red blood cells. And so your doctor may try some iron supplements to help boost that, or something called erythropoiesis stimulating agent. That just means erythropoiesis is red blood cells, so stimulating that production of red blood cells. So metabolic acidosis, that just means sometimes the pH of our blood can change in CKD. And so your doctor might prescribe something called sodium bicarbonate to help bring that pH level back to where they want it. And one side effect of CKD is actually bone disease. And so sometimes when our kidneys don't work quite as well, something called phosphorus can build up in our blood. And calcium, which is stored in our bones and helps keep our bones nice and strong, calcium likes to come out of the bones and into the bloodstream to help balance out that phosphorus. Um, and so that's why it might be important for some to get some medications to help with that if your doctor thinks it's appropriate. And lastly, we have a gland called our parathyroid gland, and sometimes that can get a little wonky if we have CKD, and so there are a couple medications that can help out with that as well. And so it is very important to take your medications as prescribed. If you're having any side effects or have any questions, please refer back to your doctor on any recommendations or dosing changes. And there are some really, really great reliable resources out there to learn more about CKD. The National Kidney Foundation website, so that's www.kidney.org, is wonderful. It has lots of great articles pretty much on any topic you can think of. So if you go to that search bar and type in potassium or sodium, it'll tell you all about it in relation to CKD. The Centers for Disease Control and Prevention, or CDC, has a lot of good information about kidney disease, as well as the National Institute of Diabetes and Digestive and Kidney Diseases, part of the National Institutes of Health. Another really great one is the American Kidney Fund, and so that's kidneyfund.org. And that website is really user-friendly. It has a lot of great guides, especially when it comes to diet, foods, recipes. So I really encourage you to check that out too. And lastly, if you are living with diabetes, the American Diabetes Association is another great website to check out. It talks about the relation between, diabetes and CKD. And once again, it also has a lot of great recipes and things to learn about, diet and physical activity to help you manage your blood sugars and help out your kidneys at the same time. And so now you'll see this little screenshot here. As Emily mentioned in the beginning, we've kind of went through the meat of our presentation today, but if you have questions, please type them into this little questions box you see here that should be on your screen, and I'd be happy to answer them for you. And as always, if you can't think of something today or something pops up later, please bring it up on your next health coaching call with your dietitian. So I'll give you guys a few seconds to type in any questions you might have, and I will answer them as they come in. Okay, and so if my GFR is down, can I get it back up? So, can CKD be reversed or improved? So unfortunately, there is no treatment or cure for CKD. Unfortunately, since it is kind of a chronic decline in our kidney function, the name of the game is to really prevent and manage our symptoms. So prevent that further decline by doing some of the things we mentioned today, managing diet, weight, blood pressure, blood sugars, and activity level. We might see some ups and downs when it comes to our GFR or how well our kidneys are filtering out our blood. But with chronic disease, we're probably not going to see our GFR improve, drastically over time. Okay. How often do I need to get my kidney blood work monitored? So that's also a great question. And that definitely depends on your situation. So sometimes in the earlier stages, doctor recommend, annual blood work might be fine. Or if your disease is progressing or in a later stage, even 3 to 6 months monitoring that blood work. So that would be a good question for either your primary care doctor or your nephrologist or kidney doctor. And one more here. So I've heard staying hydrated and eating a low protein diet can help out my kidneys. Is that true? So staying hydrated, especially in the earlier stages of kidney disease, remember we have stages 1 through 5. Um, Staying hydrated, especially with water, can be really, really great for our kidneys and helping them being able to filter out our blood as well as they possibly can. So staying hydrated with water, especially as we're in these summer months, the temperature is hot, that can really help out your blood pressure and your kidney health. All fluids count towards our hydration, but that plain water or even like sparkling water with kind of natural flavors, limiting those added sugar beverages is going to be best. And in terms of protein, so as I mentioned before, one thing our doctors will monitor in blood work is something called creatinine, and there's another value called urea nitrogen, or you might see it listed as BUN on your lab work. And those are two waste products that enter our bloodstream after, um, digesting sources of protein that we eat. And so especially when we enter, into stages 3 and stage 4 of chronic kidney disease, sometimes we actually have to monitor how much protein we're eating. Because more protein in our body means more work for our kidneys. So if they're already, working overtime to help filter that out, we might need to help them out a bit and just monitor our protein intake. And it is good too to look at the types of proteins that we're eating. And so going for our leaner proteins, so limiting our red meats, so beef, pork, and lamb when we can, and going more for, chicken, turkey, fish, and our plant-based sources of protein can also help our kidneys out too.
Well, thank you so much, Katie, for presenting this today. I hope for everyone listening, it's hopefully thinking of some more ideas to talk to your doctor about here at your upcoming appointments. Here coming up for our CKD program next month is our Healthy Eating with CKD. So please check that out, especially if you feel a little lost as to where to go for the nutrition. And then in September, we will be talking about CKD and your cardiovascular health as well. So if you're wondering how those two topics collide, please check that out as well. And like Katie already referenced several times, if you have additional questions, please do talk to your Cecilia Health coach. You can also check us out on our Facebook page as well, and also the website where you signed up for today's webinar as well. So thank you again so much for participating, and I hope everyone has a great rest of your day. Thank you. Bye-bye.